So again, and I've been playing with this technique for a while, trying to get it just right. But you want to go so just like between the iliac crest and the ribs with the thumb, so that you can invest up, because the abdominal portion is very important. For most people, it's going to be the tightest part. So invest here, invest with the fingertips, lift both. So I've got erectors, obliques from a shortened position already engaged, and then move. Good?
How far above the iliac crest are you?
I'm about mid-belly, but I'm really below his ribs. And see, right there, that's good stuff. Now, deep breath for me. Nice deep breath. I do that on most all of my clients. They all love it. It's just a great opener for the side body. Okay, so now we'll do core stuff. So let's bring that. Now again, I don't know. Go ahead.
I do something, and I guess like I had a question about it that I wanted to ask you as far as like opening up the diagonal.
Yeah.
Is I'll take this leg off of the table. Say we're working like this line.
Yes.
And I'll sort of like press down and sort of medially rotate on the femur and have them like reach up towards like that corner of the room.
Excellent. Yeah, that's going to focus a little more on the hip portion of it,
Sure.
which is great. So some variations of that would come into the lower spiral. That's fantastic, absolutely,
Okay.
and that's really good. So you're saying...
And it depends, like some people feel it more here and then other people feel it like more here.
So you're just pinning it down here,
Yeah.
and then having, so they're tightening, pinning, and then reaching.
Yeah, exactly.
Yeah, very cool. Yeah. So when you say you immediately rotate, you're just saying to drop the leg off?
Well, no, sometimes I'll just like put a little bit of like medial rotation into it and have them sort of like I guess is that? That's medial rotation, right? Yeah.
Well, lateral.
Well, if you're from an anatomical position, that would be a medial rotation of the humerus. Except it looks like lateral rotation here.
Oh, you're actually having them turn in. Okay.
Yeah,
Very
so
cool.
I'm having them like turn in and like pointing their thumb towards the. And some people, I mean, I don't feel it like that much because I guess I'm not that tight, but some people feel it like all the way from their ASIS to their thumb.
Very nice. Thanks for sharing, man. That's cool.
Yeah.
Very nice.
Sorry, I threw you off.
Not at all, man. That's great. That's great. So we just did the, yep. So that covers, you know, if you think about the sleeve, or sleeve versus core, rectus abdominis, obliques, those are your primary abdominal muscles. So we did rectus abdominis, we did obliques. You can definitely, you know, especially with this lateral tilt, you know, go in with a traditional oblique compression. It's really good. I will tell you guys, lateral tilts of the ribs, forever. You good?
Yeah.
We're always like, you know, QL erectors. No one ever mentioned obliques because, like, well, you know, they're really rotational muscles. But I will tell you, I've had a number of clients where the primary muscles in their lateral tilts are obliques.
Yeah.
I mean, they are seriously important muscles. Yeah.
I've seen some of them.
So again, what we can do here is bring that knee up for me. Just like we did with the rectus abdominis, we can come in, compress these muscles, lift them up, and then bring the leg back down. Good. Come back in and compress. Again, are you going to be able to do this on everybody? No. In fact, if you get a very large belly person, I do a lot of their abdominal work sideline. And you just have to do people like that. It just takes more time to get the work done.
Yeah.
Do it right and left.
I don't think my client that I was referring to was even open to it.
Yeah. And then you just do it whatever comes to the session. You know.
It's frustrating.
Okay. I would do more of that on him, but I want to make sure you guys get on the table. He needs that. I believe me, his obliques are wicked tight. Are they pretty sensitive?
Yeah, that was the most sensitive.
Yeah. Okay. So let's bring the hip up for me. Okay. So you want to make sure you treat both the distal and the proximal attachment of psoas / iliacus. So me personally, I like the scoop, what I call the scoop, which is where it's like you're grabbing the quadriceps, right? And this is kind of that edge between adductors and vastus medialis. You've got the tendon of rectus femoris right here, vastus medialis, and then adductors, right? If you go all the way across, you can find gracilis. Okay, I want to go up into that leg pit and I want to dive. See, there's that window right there. Okay? And I have found with my hand size that based on the size of the leg, generally, you can go right to that. But if you want to go step by step, just find that large tendon in the middle and go anterior to it. That's where your window is. But that said, we want to go in.
The triangle's right there, isn't it?
It is. You are in the triangle.
You are in it.
Mm-hmm. Oh, yeah.
They lied to you in school. You're allowed to touch it.
Oh, in fact, it's well advised to.
Yeah.
Yep. Well, I mean,
As long as you're
think about it. They're called endangerment sites, not stay away. I mean, even the name of it is just telling you, like, be careful.
Stay away sites.
Right. Just be careful.
So what are you, like on in the triangle?
So I am on pectineus, but through pectineus I'm getting to the attachment of his psoas. Right now I'm feeling his femoral pulse. That's his femoral artery. So I'm going to slide off of that. He's got a very strong pulse. And his attachment is, we got to get in there a little bit deeper. Because he's got a massively heavy leg.
I don't know if you noticed.
Right there, when we come back down, we feel that right there.
His waif.
Is what?
A waif.
What's a wave?
A really,
A really
tiny,
thin,
wavy, light person. I was kidding.
Someone who can be blown away by the wind. Sort of.
Oh, man.
Good.
Yeah, wow.
So what I did there, guys, you all right?
So ticklish there.
Oh, shit, I'm sorry. So if I bring this up, I can isolate that tendon and pin it up against this pubic bone, bring it back down. This probably won't be ticklish.
Yeah.
Okay? And then I'm going to bring it out.
Totally
And that's
different
where we go.
sensation.
Oh, man, that's awesome.
Yeah. So again, the main thing is just location. You don't have to be brutalizing in this area. The main thing is if you're going to use fingertips, right, there's the hook, but if you go this way, angle the elbow to where you can lean. You don't want to press hard. You don't want to use muscles. You just want to use body weight, pin it up, and then just rely on the movement of extension, lateral rotation to stretch it out. Get it open. Don't need to spend a lot of time there, guys. It's really sensitive. A lot of people are ticklish. A lot of people are cautious there. So I just like to go in and kind of wake it up a little bit. Most of my work happens here. So let's bring that knee back up. So we are going to start with a stretch for psoas. Right? Usually between where that ASIS is, you go in. And even, man, after, as long as I've done this work, I always have them flex into my fingertips. For two reasons. One, you can never be sure what's in here. I don't care if I work for 20 years, I will always check where a psoas is. A bicep's a bicep, right? The psoas, to me, you always want to check. Have them push the knee into your elbow. It also does, and relax. It gives you a check-in to see if they even use their psoas, right? You're going to get a lot of people they push and there's nothing. Like they don't use their psoas at all. So to me, that's good feedback. So I always check. Okay. First thing I'm going to do, one more push for me. So Claudio's okay, but he's way more hip flexor dominant. You can feel he goes into his TFL. So a very simple procedure to bring the belly button towards the spine, scoop in, and keep that engagement, push up through your knee now. And that's a lot more psoas. And back down. And relax the belly. And what I'm going to do is I'm going to start by lifting up, and then you bring your hips straight. So extend back down on the table for me, nice and slow. Just like you were doing before. Yeah. And so we're good, we're good.
Are we good? I feel like it's stretching pretty
Okay,
nice
good.
in there. Oh.
You can even point the toes.
Yeah, there we go. That's good. Awesome. And back up. Okay. So you can do that a couple of times. I'm just going to do it. We'll do it one more time. After
That's
this.
fine.
Yeah. So I'll go back to fingertips for that. Okay. So again, going down, pads of the finger, not tips. Stretch up. Once you feel like you're engaged or hooked, then you have them come back down. Don't do it sooner. Don't have them move and then try to get your stretch. It doesn't work. Get your stretch first. Then all you have to do is just be here, right? So you want to talk about working easy.
That's easy.
They're doing all the work. I'm just pinning it up.
Yeah.
They're feeling it. I might push a little more, get a little extra stretch, but that's easy work.
No need to muscle through it.
Yep. So now we're going to go back in and treat directly. So knee up for me, and back down. Again up, and back down. Doing okay? One more time up for me. And back down. Okay. So again, he still uses other muscles a lot more than he does his psoas. But we can feel that's it right there. How are we on depth? We good? It's a good place to stop you?
You can take a little, take it to the edge.
I was thinking that Aerosmith song. That's Living on the Edge. Take it to the edge.
Living on the edge.
You know I like some good body work. Take it to the edge.
Oh, Lord.
Wow.
Oh, God. I'm editing that out, by the way.
No.
There's going to be a little glip right here in the video.
Yeah.
That's
What?
like a.
We got music. Why not? Yeah.
You can just put the music in, right?
That's right.
And it's not on your face. Nobody knows it was you.
Well.
There we
It
go.
wasn't me. Gosh.
It was Claudia. It was
Or you
Claudia.
can just edit in like me going, take it to the edge, cricket.
That's right. That's right. I was going to blame it on David, but that's my name, so that doesn't work. Okay, up with the knee again. And back down.
I just really have to use my
I might have to in a
I'm
second.
suffering through this.
That's good. We'll make it quick. He's going to get work from somebody else. So I'll have to come over here. You can do it from the same side, but